Well, let's now focus on Johannesburg Hospital that is in a really difficult state. And you'll remember there was quite a lot of publicity about the paediatrician Dr. Tim De Maayer, who wrote a letter about conditions at the hospital. Well, last week he was suspended after that letter relating to the state of matters at Rahima Moosa Mother and Child Hospital in Johannesburg. So the suspension was lifted, however, after a public outcry. Well, today the Human Rights Commission visited the hospital to see if conditions at Rahima Moosa Mother and Child Hospital do amount to a violation of human rights. eNCA's Heidi Giokos went along and put together this report.
Children are dying at the Rahima Moosa Hospital due to the condition of the Johannesburg facility. Dr. Tim De Maayer wrote a letter detailing the dire state of the hospital. His words brought the Human Rights Commission to the hospital's doors. The commission sat down with the CEO and other hospital officials, but it seems as though no one has answers.
Meeting did not go as we had initially planned. It started off a bit late. We felt that the CEO of the hospital was not forthcoming with the information we wanted, because this was a fact-finding mission for the Commission to understand the circumstances that led to the suspension of Dr. De Maayer. We do understand that the matter is now with head office. It's been handled by the DDG and the MEC. It was a painful meeting. I'd say she was dismissive.
What's even more alarming is that the suspension letter was signed by the CEO, yet she wasn't in the meeting with the MEC and Gauteng Health that led to the lifting of the suspension against Dr. De Maayer.
It looks like there were some procedural missteps which warranted the intervention of the MEC. We do not know whether the MEC and the DDG succumbed or capitulated to public pressure, or it was really out of concern for the rights of the vulnerable patients.
Preliminary assessment by the Commission found that patients' rights are being violated at Rahima Moosa.
The right to health care is severely compromised. We do not think patients are receiving the kind of health care that they would receive at private hospitals.
Doctors have told the Commission that the state of the hospital is getting worse. Births have rocketed from 8,000 to 10,000 a year to now over 16,000. They say the hospital doesn't have the capacity or staff to handle this. The CEO wasn't willing to answer questions and referred eNCA to the Gauteng Health Department. For now, the doctors and nurses continue fighting on, despite being under-resourced and exhausted. Heidi Giokos in Johannesburg.